I'm Jim Check. You're watching KelownaNow. Today I have with me Ben Stewart, longtime MLA on the west side of the lake here in West Kelowna. Thanks for joining me this morning, Ben.
Jim, it's a pleasure to be here. And I know I've been to your offices before, and you guys do a great job at Kelowna now. And anyways, I look forward to talking about the healthcare crisis.
Thank you. We've seen over the past little while so many closures in the more rural areas of BC. The mayor of Mired, we did a story with him just last week. And just alone for him, 24 closures in 19 months for him. And he's had enough. He wants the NDP to hire back the fired healthcare workers. And it seems like when we close these smaller places, Clearwater, Merritt, Oliver, lots of them, it's only one or two nurses or a doctor that's missing that causes it to close.
Right. Well, the numbers are nothing short of staggering. These closures, and I'm sure some of the people that are watching this see the IH news, and it's almost on a daily basis that there's hospital emergency rooms closed in all over Williams Lake, Clearwater, Merritt. It's just, and I say that there is a problem that I discovered when I was meeting with some of the people that I worked with out of Prince Rupert, that the province and the doctors changed the model of scheduling in January. And part of that, I think, is contributing to this problem. Second, there is a shortage. There's no question. The doctors or nurses can't do it in the sense that it needs to be dealt with in a constructive manner where there's people that are there and the resources. So part of that is there's just under 3,000 healthcare professionals that were let go and have not been hired back. They're working in other types of healthcare settings. And those people should be, I think that we know the science, we know that they should be back. And I know that there's a lot of conjecture about this, but we've been calling on the government for over 2 years to get these people back. And frankly, the government, the health minister, is completely reticent to actually do that because of the fact that they made a statement and they're totally inflexible about it. So I think that's one thing, but will that get Merritt open? Will it get Hope? All of these places, Ashcroft, those communities deserve to have a schedule, and people, they need to be focused in on. So it's going to take a plan. And frankly, as you can see by the way that healthcare in the province, whether it's treatment for cancer, whether it's other emergency operations, etc., they are not able to plan and get the resources needed. And there's been all sorts of opportunities to bring people in that have been trained outside of Canada or outside of the province of BC. And there has to be a desire and a set of goalposts that they're actually going to work towards that. And the government has proven that they are unable to deal with organizing in a constructive manner how they can get these hospitals to function in our communities.
Yeah, there seems to be a discrepancy because the NDP have said to us repeatedly that these fired healthcare workers won't make a difference, and it's not related. That doesn't have anything to do with the shortages. And when we talk to your party and the Conservative Party, they say that's not true. How do they reconcile that when there's just a few doctors and nurses that would make a difference, and you're saying the number is just under 3,000? Putting those people back to work. And again, the other part of that is all across Canada and in the United States, there is no more vaccine mandates. How does BC still hold up this vaccine mandate and say that it's in the best interests of the residents of British Columbia?
Well, I don't think they can justify that. I think lots of people have challenged that. And, I hear every day about some people have had many vaccines, and some have, had a couple, and they said, I'm not going to get it anymore. They've decided, I guess they've reconciled in their own minds that, it can't be that bad. I'm surprised by people that are still turning up with COVID that have had vaccines. And so, it's a problem we have to learn to live with. But I think that the health minister and the current government's approach to this is unacceptable. I can't fathom it. I say that meaning that I've got a particular group of nurses that were very active, and I worked with them, and I met with the health minister. I wrote him letters, and he's totally inflexible on this, and it's just it's unacceptable for the population where we need nurses in these. Well, I wouldn't just say it's causing problems even here at KGH, but they have the population that they have enough, and they reduce services in certain areas of the hospital. But those smaller communities, I just can't believe Merritt, and I can't believe Oliver. I mean, we closed the Suyas Hospital, consolidated it into Oliver, and made it a larger center so that it would be staffed and meet the requirements. The population base in these communities, whether it's 5, 10, 20, 30,000 people, they deserve better. I mean, I can't believe Williams Lake is closing. I mean, look at the services that they have to provide in the
That's
care.
a pretty big city.
It is. And, when we had that wildfire up there, we had to evacuate that hospital. That was a major undertaking. The fact that we can't have enough staff to operate an emergency room, so that they can maintain the services for, I mean, it's not just Williams Lake. It's Alexis Creek. It's, Bella Coola, all of those communities that rely on Williams Lake as being their center. 100 Mile, it just goes on and on. So anyways, it's a problem.
We did an interview with the Conservative leader, John Rustad, and he was saying not only do they need to be hired back, they need to be paid for their missed work. And then we did an interview with Ravi Parmar, an NDP MLA, and he went on to say that was almost extremist and Trump-like, that he would say that, and he used the rhetoric of anti-vaxxers. There seems to be it's almost like they're treating it like it's a behavioral problem as opposed to a medical thing. And if it's a behavioral issue, is there not a sentence that's imposed? Because we've done tons of stories where a nurse is suspended for 3 days or 5 days for behavioral issues, and these people that refuse to take the vaccine seem to have gotten a life sentence.
Well, behavior, I think that probably there's a philosophical difference between the current government and the group that chooses to, take direction without any kind of ability to question what's happened. And I think some of these people, there are people that vaccines do create problems health-wise and other things. Some people believe that it's unnecessary. That's not the point. I think that the reality is these are medical professionals that have.
I think he just froze. We'll see if he comes back there. We seem to have lost Ben. We'll see if his internet connection comes back. What's that? Should do. Let's see if he calls back. Yeah, you can do that. Maybe do that, and then and just check while you're doing that if my camera's in focus. It looks a little fuzzy, but just do the first thing first, though. Yeah, see if you can get Ben back. That looks better. Yep. So we're just going to wait and see if we can get Ben Stewart back on the line here. Sorry about that. This is what happens when we do some of these things with a remote link. Oh, is that him coming back? I think we lost you there, Ben.
Okay. Can you hear me, Jim?
Yeah, you're back.
Okay. Yeah, I don't know how that this new office I was telling you about has had significant issues with the Wi-Fi and all of those things. So anyways, it's obvious that that's what must have happened. We got disconnected. So where do you want me to pick that up from?
I think you were just explaining when we were talking about behavioral issues, and you were saying that, I think you were just to the point where you're saying some of them are not accepting, and I don't know where you were going with it, but.
No. Okay, so this is consistent throughout government. This is happening in all sorts of environments where government has a large amount of workforce working indirectly for government. First of all, if we want to talk about the absolute numbers, when the NDP took over government, they had 360,000 public sector employees. It's now over 500,000 employees. That's a 42% increase in people that are working for government indirectly, whether it's doctors, nurses, teachers, or whatever. I think most people would agree that the services are not that much better. So I was going to cite other projects that require a certain level of skill by government to manage. And I know quite a number of deputies that have left government. And recently I was in Victoria and had a chance to catch up with 2 or 3 of them. And what I would say is that projects like, the bridge that's crossing the Fraser River, the Patalo Bridge, you see it every day on the news. In 7.5 years, it's only less than half completed. We built the Bennett Bridge, got it open in less than 3 years. I mean, the reality is they're complex, but there's professionals out there that can get these things done. This is happening across government. You can't get permits. On the land use, I give you an example in my own riding. The McDougall Creek wildfire that we had caused a lot of people problems in terms of, rebuilding. And there's literally hundreds, if not, there's thousands because of the White Rock Lake fire too. But the fact is these people have been stymied by not being able to get permits to rebuild. Camp Awasi, which is a faith-based children's camp that has been there for, 50, 60 years. And they've been basically told that they can't rebuild as it is. And I understand that. But the government isn't putting the resources in to help these groups get through things. And I think in healthcare, they're not listening to the health professionals. I cited an example where the government in January changed from where the schedule used to be completed by the doctors as to what shifts that they would take over the, over weekends, etc., so that there wasn't these gaps. And now the doctors in that particular situation have essentially changed their status, and they're doing locums rather than being an employee of the hospital or that. And so what's happened is that they pick and choose the shifts that they want, and they won't fulfill the evening shifts or weekends, etc. And that's where these gaps are starting to happen, at least in Prince Rupert. And I don't understand that. I talked to the people in Prince Rupert that had firsthand knowledge of that, and that's creating problems in Northern Health. And so it's a similar occurrence in the sense that there has to be a level of accountability from government on the people that are paid by taxpayers, and that's what's not happening.
It seems to I've done a number of interviews, and it seems to be that the more rural areas just don't get the attention that the Lower Mainland gets, and it seems that they're being asked to go without health care when there is a solution there that they could bring back these just under 3,000 healthcare workers. And I've interviewed a few of them. And we did interviewed a lady on Thursday that should go up maybe today or tomorrow. And I interviewed a doctor just recently. These are people that aren't allowed to work in IHA or BC healthcare.
Yeah.
So how like the merit is frustrated. There's people that say they want to go back to work. How can they continue to do this? What pressure will your party put on them or continue to put on them? And then what's the difference if you win and then you become the government, what would be one of the first things you do with these people that are still out of work?
Well, we've already said that. We've said it for over 2 years, Jim. These people would be reinstated and have their jobs back. The compensation you mentioned, that's something that we haven't discussed, but I think that based on the fact that, there has been, I think that they've been punished by the government, and I think that's unfair. But Jim, to your point, the number of workers that are off is not out of the overall healthcare thing. That is not going to solve this problem. There is a management issue. Just take, for instance, the number of, like Alberta operates with, I think, 7 vice presidents in the health authorities across Alberta. Similar size population just behind British Columbia. We have 42. The fact is that we have an organization or organizations that are mired in bureaucracy, and unless we get to actionable items where we can start to measure and be accountable for these things, we're not going to see the results. So that's only one small part of the overall solution.
I
We
get
need
that. I get that
doctors.
that's not the total solution, but to those people that are still being punished, it will help,
So
I'm sure.
that's
Right?
right. Okay. So if that's what your aim is, I mean, we're supportive of that. So we have no
Okay.
problem in that. Ask Andrea Henders. If you haven't met Andrea Henders, she's in my riding here. She and her husband, who is a pilot, were both let go during COVID because they didn't get vaccinated. Andrea's been very active in organizing. I've had multiple calls with them and was part of the group that made certain that these people would be reinstated. And that's part of what it is that we're trying to do.
While I have you here, you mentioned the McDougall fire. We've done a lot of stories on forestry as well. And we just did a recent interview with Aspen Planers, Bruce Rose. Again, frustrated with the current government. They can't get access to timber. And then, there's a group out there now promoting, and he spoke of it as well. If wildfire is one of our chief concerns, and like climate change and wildfires, and it's one of the biggest contributors to climate change, why is the current government not encouraging better forestry practices and allowing companies like Canfor and Aspen Planers more access to timber, again, more jobs, and then better management of the resource?
I think that, a number of years ago, probably over 10 years ago, I sat on a committee that went around the province called the Midterm Timber Supply Committee. We were looking at things with mountain pine beetle, a lot of the problems, a lot of the pressures on the environmental side, what they called visual quality corridors and things like that. I think that these forest companies are very responsible. I think that they often get criticized for not doing the proper work. What we need to do is actually listen to people that are forest professionals, foresters, not necessarily the CEOs of these companies, because of course they have different mandates. But in our particular area here, we have Gorman Brothers Lumber, a family-owned operation for over 50, actually over 75 years. And they're very clearly one of these big supporters of where, reforestation, selective harvesting. Sometimes, there needs to be these fire guards that are cut with the intention that it reduces the ability around communities. Last year would have been a perfect example of some of that forestry practices had been around West Kelowna. We wouldn't have seen the tens of thousands of people evacuated around the province. We had over 10,000 right here in West Kelowna. The situation is that forest practices have to evolve and change. And the reality is we're not listening to the professionals. There's a lot of people that, are against the idea of harvesting any trees. There's no fiber that should be harvested. That's not right. I mean, the reality is that, the idea of controlled burns, that has to happen. I think that the forest companies need to actively, be allowed to, under permits, be allowed to actually cut and harvest around communities to protect them. Then we need to look at, on the bigger picture, how do we, reduce just wildfires in other places. We had one up in Peachland the other day, just in behind the community there. I think that the reality is that good forestry practices will lead to better, better health of the forest. I think there's a lot of people that are concerned that the forest practices have been too broad in terms of allowing what they call clear cuts without any regard to diversity and things like that. And I think that that's where the professional foresters can work to help make certain that it may be a more expensive process to selectively harvest, to do those things. But the reality is we need diversity in the forest. We need to listen to professional foresters and make certain that these fiber does get to these mills.
So Mired had 6 mills. That's 0 now. And that's a small community that's heavily based on resources. And, they're facing that as well as a healthcare crisis with closed. And that mayor is seems like beyond frustrated and with the current government. And it doesn't seem to be that they're listening to him. So the last thing I'd like to ask of you there. What's that?
Yeah.
Go ahead, Ben.
I was just going to say I have been to Merritt, met with the mayor personally, and Jackie Taggart and myself met about the bridge that was washed out there. And I think, if I'm not mistaken, I heard the other day that they were denied a permit to rebuild that bridge, even though the funding had been secured. I honestly, I don't know what it is with the province, but they've got to put some resources. I mean, if you look at Lytton, I mean, the fact that we've got 2 or 3 houses after 3 years, merit. I mean, to be honest, this is a government that is totally lower mainland focused. They're not focused in on the interior.
I think we mentioned that in the beginning. It seems like they've turned their back on most of BC other than the lower mainland, where the bulk of the votes is. And it seems there's a lot of frustration boiling up in many of the more rural areas. I do have one last thing I'd like to ask you. There's a significant event that happened south of the border here this past few days. And they're saying a lot of it has to do with like the rhetoric that is kind of like on both sides of the Republican and Democratic Party, and usage of words and that. And we see some of that here when we see, people saying, like voting for a right wing, or the people have labeled Pierre Poilievre as right-wing extremists and John Rustad as a right-wing extremist, and like their threats to democracy and stuff like that. And and even when we talk about climate change, they talk about existential threat. That seems to embolden people to do actions that maybe they wouldn't do otherwise. What's your thoughts on all this like political rhetoric, and where do we go from here?
Well, I think as you look around the world and governments have been changing, I think that, you look at France, you look at England, and some of the other countries that have had recent elections, and they've been totally surprised by the swing from one side to the other. And I think that this happens. People get dissatisfied. As I've always been told and led to believe by past premiers that I've worked with, that you might be elected on one side of the spectrum. When you govern from more of a centrist position. And I think that people are frustrated after COVID. They're frustrated by the economic chaos that we've been going through. Look at the inflationary pressures now. We may have lived through the late 70s, when I can remember I got a job in 1975, and there was wage and price controls, and there was also, my income was capped at a 10% increase per annum. I didn't really think much about it at the time, but I can tell you that people are frustrated by these things that are happening in their world. So where do we go from here? I think that I think people are looking for different options than they've had in the past, and I think that both Pierre and some of the positions that we've put forward might seem extreme to some people, but the reality is people are absolutely fed up. Look at the capital gains tax that just came in. It doesn't seem like much, and the way it's marketed as being only affecting a small amount of people, but it does affect people. A lot of people, have their savings in a home, and they're looking at trying to realize that for their retirement. They don't have a pension plan, and I think that they're fed up with this constant barrage of tax creep. And we've seen 32 increased or new taxes in British Columbia in the last 7 years. That's scope creep. In my mind, it didn't need to happen. You can't even buy a used vehicle now. There's no exemption. It doesn't matter if it's $10,000 or $20,000. A family that's just getting started are having to pay PST on that used vehicle, which it's all about punishing people because they believe that people are falsifying the values, and maybe that goes on. But the reality is they can deal with it in a different way than having to tax people into what I would say is a level of poverty that they shouldn't be faced with. So I think people are frankly fed up with government's creep and scope. I mean, look at the Land Act amendments that were proposed in this last legislative session that essentially would have given First Nations across BC the ultimate right to decide if anything on the land use could be done or not. That's just not the way that Canada was set up, or the provinces. The reality is there has to be a single form of government, and the Land Use Amendment Act is probably the biggest threat that we have. If this election goes back to the NDP, it's going to mean that those land use changes are going to come into, and Merritt and other communities that have been facing these problems, it's going to get a lot worse.
I guess more specifically, I was wondering, like, the assassination attempt on former President Trump, is the media and the politicians responsible for some of that rhetoric that they continue to put out there? Is our industry responsible a little bit for some of the, like I think we use some language sometimes, existential threat to democracy, those kind of words. Is it the onus on us as the media and on politicians to tone down the rhetoric and just talk policies like you were just talking, just more about what's good for Canadians, as opposed to like just how we label people, the words anti-vaxxer, different things like that, as opposed to just talking policy and what's better for Canadians?
Well, I think you're right. I think that the language that we use and the media has definitely changed. And I think that there's a lot of people that actually I talk to that are frankly not very happy about that. They don't like that approach. They want to make certain that that there's a realistic approach to these things. And, it's funny, I can't help but think about that interview that Pierre did in the South Okanagan eating an apple. And the fact is that the interviewer continued to, put words in his mouth, and he kept standing up for what he said. Well, who is it? Who are they talking about? I think that the reality is that there has been a language shift. And I think that with the US, no doubt, I don't think of the people that are supporting the current president as being, as angry as that. But I think that there is a divide that has been growing, and that's not healthy. I think that, it used to be comfortable talking about politics and having different points of view. And now it's kind of like, you become labeled if you happen to be one of the, the two parties in the US. You're either a Democrat or Republican. And I think that the reality is, I think that there's been a lot of great Republican presidents, and they've done many things. The same with Democratic presidents. So they're not all perfect. That's the way politicians are. But I do think that I think it's very unfortunate that incident occurred. And I just, I hope that, that things go smoother. And it, as the president said last night, hopefully we're a little bit more in check on these things. We need to bring the rhetoric down.
Yeah, because we have seen it used by the NDP for sure. They've attached labels to John Rustad by saying Trump-like, and we have seen our federal government right now using those labels against Pierre, trying to use whatever that hate for that former president and attach it to Pierre as right-wing extremists, and it seems like an unfair tactic to be doing, and this is where it leads us to. And I just wondered if we should all just dial it back a bit.
It's I tend to agree. I think that labeling people like the NDP labeling the leader of the BC Conservatives as being that way. I know the leader very well, and I can attest to the fact that he is not that way. I think that people just, sometimes there are people that you get in your party that are of that. I mean, the fellow that was recently didn't show up in court that, has been causing a number of problems just in Kelowna here during the protests, etc., during COVID, all of those type of things. I think the reality is that there's somebody that is an extremist. He's proven beyond a doubt that he supports that type of action because he thinks that that's the way of getting his message across. But I really do believe that we need to take it down. And I, when I opened Quails Gate, the official opening we had in 1998, we had a federal Liberal Prime Minister, Jean Chrétien, open it. And frankly, if you look at his record compared to some of his predecessors and people that have followed, I think that he was one of those more middle of the ground type of people that people really respected. I unfortunately think that they've lost the plot in Ottawa these days. And I think that we're, I, like many people, want to see changes. And I think it's less bureaucracy, less of the rules that we've come to, there's rules for everything. And that's where, with the local NDP government at BC, I keep telling them, put the rule book away and bring out the playbook.
Yeah, I was fortunate enough to meet both Jean Chrétien and Stephen Harper at Level Up event that we held back in 2019, and they're both very great leaders of our nation, and we could use some of that today.
Well,
You're not running for re-election. Is there anything that Ben Stewart wants to finish before the election?
Jim, there's so many projects. One of the things you realize when you're in government is that there's always so much work to be done and lots left. And every day we're here working on things such as the people that are impacted by the White Rock Lake fire, still getting permits. The ones at Lake Okanagan Resort. I just unfortunately got a letter that wasn't very helpful from the housing minister on Lake Okanagan Resort, and I had hoped that we would at least get to the point where we were moving ahead with these people that would have some hope, and unfortunately it doesn't look that way. But anyways, I continue to try to resolve local matters on a broader scale. I think that accountability in this election is something that I'm going to be clearly pointing out, that I don't think the government has been as accountable as what governments need to be. They've almost doubled the budget. The deficit's the worst that it's ever been. And frankly, what services are we getting better? So frankly, I'm disappointed. And of course, I would have loved to have run again. But after over 15 years of being elected, I came to the conclusion that I will never resolve everything in my lifetime. And I am happy to support my colleagues that are running again and the candidates that we're fielding. And they're really good candidates. And you know what? We'll see on October 19th what ends up happening.
So there's a political retirement in your future. What about the rest of it? Are you just going to work in the valley here on the winery, or you got other plans?
Well, recently I had a little bit of insight into, the damage that we've sustained over this last winter event. We had two winter events. We had one in 2022 where we had cold temperatures in December of 22, and then this other event in January of 24. And because of the contacts and the relationships that I have really on a global scale, I'm going to take it upon myself to do more of an investigation to see what we could do differently to help make the industry more sustainable. I want to make certain that tourism rebounds, and I know that it's been tough on the tourism sector. The other thing that last week I was meeting with the consul generals of Korea, Japan, and China to basically talk about what's happened with our trade relationships. And frankly, I can't believe that after probably almost a century of building up relationships in these other countries, the current government decided to close all 14 of our trade offices in Asia. It doesn't make any sense at all. We depend on trade. We are a province. So I intend on, trying to help those relationships get back and get reestablished. And I know that some people, have different points of view on, the different countries. They are very different, but they're not the same as Canada. And that's why Canada is such a great country. And I think that our leadership internationally has been, I think it's been damaged in the last, years. I remember meeting with Stephen Harper in Beijing back in 2016 when the G20 meeting was there, and or 2015, I guess. Anyways, you know what? Canada has a very important role as a leader globally, and I want to make certain that we take full advantage of the fact that our relationship leadership is something that we temper what's happening in the United States, and whether it's other countries, whether it's Ukraine, Russia, China, whatever. Bottom line is we need to be seen to be, a global leader in that.
Well, I thank you for your time today, Ben. And it looks like another beautiful day in the Okanagan.
You're right.
Anything you want to add before I let you go?
Jim, it's been a pleasure. Thank you.
Thank you. And thank you for watching Kelowna Now.